the question then for everyone out there looking at all these parameters and buying more and more things to value their data of health and thinking they're healthier because of it would be, okay, what should we be looking at, especially if we're in a somewhat diseased or symptomatic state and trying to find out the whys.
Right. Brings us back to biological medicine,
Yes.
right? Like when you show up, which is always people are like, well, what is it? And I said, if you're looking for normal, looking at just biology and physiology, and you're really trying to figure out which organ system is causing a problem, right? Because it's not like you can have IBS and it has nothing to do with your small intestine, right? It has everything to do with your nervous system that's affecting your small intestine, which is why I say it's like a bunch of karates thrown into one. If you actually show up to a place and instead of doing 1 point testing, you show up to a place and they track you with real-time HRV and real-time EEGs and thermographies and these kind of things, and you get to see, like I'm looking at the lymphatic system, nervous system, and I got this hormone test, and I'm doing these things, but I'm also looking at them at a clinic in real time.
Yes.
I think then some of that information that you take home may be worthwhile, but when to a person, when people show up here and they bring me that binder, I validate that they've done the work, but I rarely will look at it because I
Yeah.
want to use, with biological medicine, like you're looking at these big systems like the autonomic nervous system and the lymphatic system, you're piecing all these things together. And then those little breadcrumbs that may be dropped by some of your stuff, I'm not going to say aren't valid, but it's more important. Like this biological medicine is one-on-one. You know that, right? Like it's not something where you're like, okay, well, our readiness score is good, so let's do the workout of the day and see what happens. It's like you're really like, it's like veterinary medicine. Every animal is different. And I know that's like kind of a funny thing for people, like, oh yeah, everybody's unique. And it's like, no, no, no. Like you really, if you want to get, especially performance, because I see a bunch of pro athletes, if you want to do that, you're working in this top 5%, you really need to have the tools to do the other assessments so that you can see like what organ system like needs that support. And then get the tracking away from the other ones because you're really only focusing on making one stronger so the other movements or the other organ systems are stronger. And I think that's, unfortunately, everybody's getting out of clinic medicine, right?
Right.
Because
Right.
everybody can do this, right? Why would you have brick and mortar when you can do telehealth? And it's like, well, yeah, I do telehealth and I send you home with your Whoop band and Aura ring, and I'm shipping you your blood tests and you're doing your micronutrient profiles. And I'm like, all right, like that's good. But again, like you only saw one moment of one time. Like you didn't actually get the person. You didn't do the battery of in-house testing. And I still think like there's few clinics like yours that have that in-house response where you're looking at like this is a performance facility, right? You are in disease. You need to get into performance. And in order to do that, you check yourself in, right? You cannot do that. You can do any medicine, any lots of forms of medicine telehealth wise. Oh, Casper, you got a cough? Okay, here you go. Like try this out. I'm going to ship this to Walgreens. And it's like, that's called practicing medicine. That is a true practice of medicine, right? I'm going to practice on you. When you're doing things in-house and you have a facility, like the practice portion of it becomes very minimal because you're actually doing things to the mammal, which is us, and you're seeing how they respond. And then
Right.
you get a much better effect when you're not like just practicing. And I think that's why people got their wearables. And that's how it became like the lab companies, everybody's sending stuff in, everybody's doing 10 times health. Like this is how I'm gonna do. And if something's high, I'll just make it,
Yeah.
I'll decrease it. And if I can't eat eggs, that's great. And my vitamin C was low, so I'll put it high. And essentially, you end up with this functional medicine model, which is like just move the number, right? If it's high, move it down and it's like, I get it. And people can do that at home, right? You just end up with your own custom supplement pack, but it still doesn't translate into performance. You're just moving numbers. That's called health accounting to
Yeah.
me. And so there's practice of medicine, health accounting, which everybody's doing at home. And
Yep.
then there's like, okay, what is biological medicine is performance-based medicine, right? You're
Yep.
trying to take somebody with something and you're trying to get the most out of biology and physiology. But in order to do that, you have to have a lot of tools to do the assessment, and you have to have like fancy tools to do treatments. It's not just about taking things.
Yeah, I think that's always been my biggest knock with telehealth and that movement for convenience, but that convenience comes at a cost. And that cost is you're not going to have the tools, you're not going to have the expertise in-house, as you said, to truly address things in a quick manner. I think we
Right.
could probably agree that if it's not a complex chronic disease, lifestyle changes over a period of years and doing the right thing, with the right person and trying to personalize off of those, downstream numbers that you're getting and data could work, could. But it's going to take probably years, number one. And number two, it's going to
Yeah.
be a lot of ups and downs and trial and error. And this is, in a lifetime, how many years do you really have, that are left for you? And do you want to be doing that trial and error without real help or without real tools in that toolkit that can catalyze on that?
Right. You and I can go to a gym, right? We would pick
Yeah.
something. We would pick something. Like we would go and learn whatever we want to do. If a normal person gets a gym membership, they head to the gym. Everything's available to them. They start doing their own workout plan. And I'm going to there's no way that you're going to smoke somebody else that's got a trainer and is doing training. Like if you say, I'm going to go do this mud race, and I'll be like, all right, well, that's a pretty generic thing. And that person is doing sport specific training, and you have all the same tools. Like you can do your blood tests, you got all these things, but the person that's actually looking at the person and picking out where their weaknesses are and strength and capitalizing on the exercise, it's like you're not going to beat that. And I think like you and I could both say you're going to get more fit, right? If you take lifestyle and you're on Instagram and you're looking at some of this stuff and you're like, hey, if you do like 15 minutes of deep breathing and stretching and you go for a walk and you get out in the sunshine, you could take any mammal. My cat could do that. And I bet I'm going to get a better cat in a month. But my cat's not guaranteed to live longer doing that, right? And my cat's not going to be faster and stronger. And when you're talking illness, like you've got to not be normal. You've got to be better than normal to bring that back to a new set point. If you're just me and you in a blue zone, yeah, we can just eat some sardines, walk around, like get some sun. Like I don't think there's going to be much. Like the biological like tax is not going to be high. Like if you
Right.
are my CEOs or my pro athletes, like the biological burn rate on that physiology is immense. And we could say that the normal person walking around now, right, with genetically modified foods and all the terrors that are in our environment, like you're not just passively like health. Even when I started, used to be a passive thing. If you didn't smoke and you
Yep.
didn't eat cheeseburgers and you walked, well, you're pretty good. And now it's like, no, no, no. Health is not passive anymore. It's active. And longevity, like I say, you either practice longevity or pay for longevity, and you got to do both, right? Nowadays, because the environment is such a burden on you, and we all know this from doing biological age testing and everything else. That's like, look, we're just breaking down faster. Plus, we're trying to do more. Plus, we got digitalization, so like we're interrupting our sleep, and our nervous systems hate all this dog whistles going on. So you've got to do more specialized stuff if you really were interested in it. And I think that's, biological medicine was before its time, where it was complex and it took into all these accounts. And so people are now graduating into that where they understand the complexity, I guess, of physiology because they've got these everything on, they're getting all this data, but it's like, yeah,
Oh,
but you're not going to put that together like, the few people that have experience in North America to put that together. And I think that's going to be the differentiator, right?
yeah.
It's
Yeah.
you got chronic disease that everybody's got nowadays because 30-year-olds
Everybody.
have it. And then you got longevity, which everybody wants to live to 150. So you got these two, and those two take a high degree of specialization, and you have to have tons of treatment tools. And
Yeah.
the rest of
And
it is a practice.
yes. And that's where I believe biological medicine, it is the solution to the problem we're seeing. The problem is, okay, 60% of us are chronically ill. We are only managing their disease as they slowly wither away and putting them on more and more medications. That is not a
Right.
solution, right? That is absolutely, we're trending in the wrong
Management,
direction, right?
management, right?
It's
Mm-hmm.
management. It's sick care management, not health care.
Right.
And then you
Right.
do have your others, the biohackers, the others that really want to optimize, live longer, live healthier. That is also the solution.